We will improve the health of children by improving the health outcomes for every child. And to do that, we'll need to be able to uniquely identify each one. My name is Derek Ritz. This three-part video series has been developed for the Asia eHealth Information Network's Regional Enterprise Architecture Council for Health, REACH. Support for the series has been provided by UNICEF, WHO, and ADB. This is video number 1. It lays out the challenge we're trying to address by implementing unique IDs for health. So, what is the challenge we're trying to address here? Perhaps the easiest way to illustrate the problem is through a short story. Meet Kanya, an adolescent girl of 15 who lives in a lower-income country in the Asia and Pacific region. Kanya is among the 1 in 5 girls in her country who is married before the age of 18. This is Kanya's health story. Concerned by his high-risk behaviors, Kanya worries that her husband may have infected her with HIV. She attends at a voluntary confidential counseling and testing clinic where she learns the unhappy news that she is, in fact, HIV positive. As a further challenge, Kanya also discovers that she's pregnant. Kanya's condition is noted by a community health worker in her village. Following the counseling from the community health worker, Kanya attends at the antenatal care clinic in her district. Ideally, as an HIV-positive mom, Kanya should be put on a prevention of mother-to-child transmission, or PMTCT protocol. Under this protocol, Kanya would be given antiretroviral medicines. But hold on, we need to ensure that the connection is made between Kanya's HIV-positive status and her pregnancy. Let's assume the clinician at the district hospital takes Kanya's HIV-positive status into account and that she is prescribed antiretroviral medicines. The PMTCT protocol includes specific instructions regarding the management of Kanya's labor and delivery. When Kanya's son is born, the guideline is that he would also be put on antiretroviral medicines. But hold on, this requires that everyone at the birthing facility is aware of Kanya's care protocol and about what it means for Kanya's son. Let's assume the facility's staff are aware of Kanya's protocol and the impact it will have on her baby. Of course, all babies should be immunized. But hold on, Kanya's son's antiretroviral medicines impact the vaccines he should be given. There is clearly a lot of coordination needed if this is to go well. Importantly, these are not isolated events. For Kanya and her baby, these episodes represent the arc of their health story. And here is where we begin to see our challenge. Here is where we start to appreciate the scope of the problem we need to solve. For Kanya and her baby, their health outcomes rely on a cumulative success, on connectivity and information sharing along their storyline. This is a crucial point. In recent years, many countries have made ICT investments to help them better collect aggregate indicators. These indicators may be used to measure the cascade in the care delivery network. With these indicators, the ministries of health can report on the number of HIV-positive pregnant women, and how many of them know their status, and how many are put on PMTCT, and when their babies are born, how many of them are also put on antiretroviral medicines, and how many are correctly vaccinated, and so on. The magnitude of the drops in the cascade are heartbreaking. Where Kanya lives, for example, less than half of HIV-positive pregnant women know their HIV status. Just 10% are on PMTCT, and only 4% of the babies born to HIV-positive moms get the guideline-based care they need. And this is just one of dozens and dozens of examples of cascades with huge care gaps. Gaps that adolescents, children, and babies fall through with alarming regularity. And it's not just the children. These are care gaps that everyone falls through. In its 2015 document, An Agenda for Every Child, UNICEF advocates for an evolution in how we leverage ICT investments to start to address this problem. We need to harness the data revolution, to disaggregate our indicators. We need to invest in systems that enable us to track the progress of every individual child. So here then is our challenge. We need to take the next step. We need to move from measuring how wide our care gaps are to making the investments needed to start closing them. And as we start to collect disaggregated data, as we start to improve our care continuity on behalf of every child, we will need to have a way to identify that these data are about a unique person. We will need a way to know that this is Kanya's story. Video number 2 in this 3-part series describes the role unique identifiers play in helping us more effectively care for every child and the important ways digital health technologies can operationalize these IDs. You can find this video and other AeHIN Reach artifacts by visiting www.aehin.org. This video was produced with support from AeHIN's development partners. The content was created by Derek Ritz, Lori Thorell, and Wingxi Chen. Thank you for watching this video.